My name is Lynn Huck. I'm a nurse practitioner with urology at Prisma Health. Urology is anything, both male or female, that has to do with the urinary tract, the kidneys, the ureters, the bladder, and we deal with all of those issues in both male and female. I've worked in many areas during my career, and I just found urology fascinating. And I found that the patients in urology, they genuinely want to improve their quality of life, and it is so fulfilling to me to help people fulfill that need in their life. I believe that in healthcare in general, every person has a right to be an active participant in their healthcare. I believe to do that, they need to be able to have an open conversation. They need to be able to have all of their questions answered so that they can make an informed healthcare decision. I am an active participant in making sure patients feel comfortable to ask all their questions and respond in a manner that enables them to understand the medical terms that surround their healthcare choices. One of my favorite cool things in urology is that we are doing more research and more support of women's urological issues. Because if you mention urology, a lot of times people think of men and their prostates and men and their urology issues, and they forget that women have just as many urology issues as they get older, and there hasn't always been enough research into these areas to give women the support they need to have a better quality of life. My passion is that as we get older in life, that's where you tend to see a lot of people with urology issues. And it affects their quality of life. It affects them being able to travel, to go out to dinner with their friends, to go to their granddaughter's dance recital because they're worried about their bladder and their bladder issues, and they're embarrassed. And it affects their quality of life. And as we get older, we deserve to have a good quality of life. And if I can help patients have that, that to me is worthwhile as a career. I like to start with what patients feel they need to do, feel they can do. And we talk about their lifestyle, things that they are able to do for themselves, their own homework, as I call it, that they can do. And I always encourage patients that it's the small steps. And I think patients respond better, we all do as people, to smaller steps and feeling comfortable knowing that we're moving along a pathway to better health than to saying we have to make some giant, huge change in our life all at once. Outside of healthcare, I'm a baker. I love to bake. I rock climb. I bike. And I love to travel. To make an appointment with me, please ask your doctor for a referral.